Welcome, everyone. We're here today to talk to Otto Lin of the Digestive Disease Institute at Virginia Mason Medical Center about his upcoming paper entitled Disparities in Prevalence, Location, and Shape Characteristics of Colorectal Neoplasia between Korean and Western patients. Otto, can you give us some background on why you decided to embark on this study?
Well, Dick, last year we had a visiting research scholar from Korea, Dr. Cha, who worked with us on a number of projects. One of the ideas was to look at the prevalence and distribution of colonic neoplasms between different countries. As you know, there are well-established and widely accepted colon cancer screening guidelines in most Western countries, including the U.S. However, these guidelines might not be applicable to other countries, not just because of differences in healthcare resources, but also because of differences in epidemiology. We had previously done a similar comparative study with collaborators from Taiwan and had found major differences in the prevalence and characteristics of polyps between U.S. and Taiwanese patients. However, other studies have shown significant differences even amongst different Asian populations. So we really can't think of Asians as a monolithic demographic group. That's why we thought that it might be interesting to look specifically at Koreans and compare them with American patients.
Can you tell us about the design of the study?
Well, this was a cross-sectional controlled study comparing two similar cohorts of patients aged 50 to 69 and undergoing their first-time screening colonoscopy. One cohort was from Virginia Mason. The other one was from Dr. Cha's University Hospital in Seoul, Korea. Patients were excluded if they had symptoms, of course, since this was a screening study. They were also excluded if they had a family history of colon cancer or a personal history of adenomas. And since we wanted to really focus on the first-time screening colonoscopy population, we also excluded any patient who had had a previous colonoscopy. We specifically compared the prevalence, the anatomic distribution, and the shape and histology characteristics of all polyp findings in the two groups.
And what did you find?
Well, we had 3,460 subjects in the U.S. cohort and 2,193 subjects in the Korean cohort. Now, even though the overall prevalence of adenomas and advanced neoplasms was similar between the two cohorts, there were still some significant differences in terms of the distribution and characteristics of the polyps. First of all, the proportion of proximal adenomas was much higher in the U.S. cohort. About 63% of all adenomas were in the proximal colon in the American patients versus only 46% in the Koreans. Secondly, there were many more large flat adenomas in the U.S. cohort compared with the Koreans. In fact, there was a five-fold difference in the prevalence of large flat adenomas between the two groups, with an overall prevalence of 2.6% for the U.S. Patients and only 0.5% for the Koreans.
Were there any other differences?
Well, if we stratify the data by sex, we found that American women had a much higher prevalence of adenomas and advanced neoplasms compared with the corresponding Korean women, while no such differences were seen in the male patients. But for both male and female patients, the prevalence of large flat adenomas was higher in the U.S. cohort.
How is this different from some of the other studies on the Korean population?
Well, we were very careful to select for a first-time screening colonoscopy population of average risk. Thus, none of our patients had had previous colonoscopies before. We also made it a point to recruit large numbers of subjects in our study in order to minimize the possibility of a type 2 error. This is the first study to directly compare matching cohorts of screening colonoscopy patients from Korea and the US. Previous studies on Korean patients had been mostly uncontrolled and had seemed to suggest that Koreans might have a fairly high prevalence of flat adenomas. In fact, because flat adenomas had first been reported in the Japanese medical literature, it was initially thought that this phenomenon might be more common in Asians. This was until a landmark study by Roy Sortigno on a large VA population here in the US demonstrated that American patients also have a significant prevalence of flat adenomas, mostly in the form of sessile serrated adenomas. I think flat adenomas are now recognized as one of the leading causes of missed lesions and interval cancers after screening colonoscopy in this country. From our study, we now know that Koreans actually have a fairly low prevalence of flat adenomas. And again, I think this illustrates the importance of doing controlled studies as opposed to relying on data from separate uncontrolled studies.
Were there any limitations to the study?
Yes, definitely. First of all, the two cohorts were not perfectly matched, especially with regard to sex distribution. About 60% of the Koreans were male versus only about 48% in the American patients. However, even when we adjusted for sex, this did not change our findings in any significant way. There were some concerns that any perceived differences in the prevalence of large flat adenomas between the two cohorts might actually reflect differences in endoscopist interpretation rather than any true differences in the patients. However, we took care in both hospitals to adhere strictly to the Paris classification system. And Dr. Cha and myself personally reviewed all the medical records to make sure that the same definitions and criteria were being applied to all subjects.
What's the take-home message, Otto?
I think there are several things we can say from this data. Number one, Korean patients have a less likelihood of having large flat adenomas than American patients. Number two, Korean patients are less likely to have proximal adenomas than American patients. And number three, Korean women are less likely to have adenomas and advanced neoplasms than American women. And finally, these differences have implications for colon cancer screening guidelines in Korea. We don't want to make the mistake of indiscriminately adopting American guidelines to other countries.
So, all in all, Otto, it looks like great work. Are you planning on extending this to other countries in Asia or around the world?
I think that thought had occurred to us. I think as soon as we find suitable collaborators in these other countries, we might be interested in doing that. I think it's a fascinating subject.
We look forward to it.
Thank you.